Good evening, everyone. Thank you for joining us this evening. We really appreciate you taking the time and spending about the next hour and 15 minutes or so with this evening. I'm really excited to introduce our panel. We're going to talk about careers in nursing. Um, this is our third in a series of three webinars entitled Diverse Perspectives in Nursing. This is in conjunction with our partnership with the Thurgood Marshall College Fund. Um, we want to acknowledge any students that might be joining us this evening who are attending any one of their member HBCUs. I'm a proud alumna of the first HBCU, Cheyney University, so I'm happy that you could join us this evening. We also want to acknowledge all the other I'm saying prospective students because we hope you will join us at Penn Nursing. And it's really interesting. Thank you for putting in the comment section where you're joining us from this evening. I think the prize goes to the person who is attending from Seoul, Korea. Thank you for joining us. And then we have, Philly is in the house. I saw New Jersey, Howard University, Pitt, Maryland, Bowie State is here. So we really enjoy the diversity, California residents. So thank you so much for joining us this evening. I do want to say a few housekeeping things. This session is being recorded. So we will send that out in a couple days. I also want to just really thank our panelists once again for joining us this evening. They are representing our network of hospitals within the Penn Medicine system, and you will hear from them shortly. I next want to introduce Jamie Idlin, who is our Associate Director of Admissions and Marketing for our graduate programs. And Jamie will introduce our panel and facilitate our session for the evening. So thanks again, and we appreciate, again, you joining us this evening. Jamie?
Thank you, Melissa. Welcome, everyone. It's great to see all of you, and I see a lot of familiar names from the past few webinars we've done, so it's great to see everyone again. We have a fantastic panel of colleagues and professionals from our Penn Medicine Health System and the Children's Hospital of Philadelphia, and we specifically chose representatives from these hospitals, not only because they are fantastic and these hospitals are great places to work, but also there are tuition benefits at these hospitals if you attend Penn Nursing. And in addition to whatever tuition benefits you receive if you work at one of these hospitals and attend Penn Nursing in a graduate program, you receive additional tuition benefits from us. So we really hope that wherever you are in your career, if you are not a nurse thinking about going into nursing, you're currently a nurse thinking about going into an advanced practice position, we hope to keep you in this system. We hope to give you some great benefits in your academic journey and also your professional journey. So tonight, we have Barbara Todd, who is the Director of Graduate Advanced Practice Education at the Hospital of the University of Pennsylvania. Sharon Irving, who's a nurse practitioner in critical care medicine at the Children's Hospital of Philadelphia. And she also teaches in the pediatrics courses at Penn. Diane Gorman, the lead MICU hospitalist in the Medical Intensive Care Unit at Penn Presbyterian Medical Center. And Rochelle White, who's a nurse manager in maternal fetal medicine at Penn Medicine Princeton Medical Center. So I'm going to stop sharing my screen so we can see each other better. So first, we'll start with the more personal side. So if our panelists would like to introduce themselves, share their background, a little bit about how they got into nursing, why they chose nursing, and how they got to their current career and position.
Hi, my name is Barbara Todd, and as Jamie mentioned, I'm the Director for Graduate Advanced Practice Education at the Hospital University of Pennsylvania. I've been at what we call HUP, or the Hospital University of Pennsylvania, for greater than 20 years. I've always wanted to be a nurse, so I think as early as age 3, my mom and dad told me I said I wanted to be a nurse, and I kind of stuck with that. So I always wanted to be a nurse, so I pursued that. And I got my first educational degree in nursing actually from Howard University in Washington, D.C. So I graduated from one of the premier HBCUs. Nursing is a passion for me, so I started my career at Case Western in Cleveland, Ohio. Came to Penn and have really loved being at Penn. I worked as a clinical nurse for several years, taking care of cardiac patients in both the med-surg space and the intensive care space. When I graduated from Howard, I said I wanted to be a nurse practitioner. Didn't know really what a nurse practitioner was at the time, but I knew it was something I wanted to be because I had seen a nurse practitioner at Kaiser with my nephew. So I went on to become a nurse practitioner. At the time, primary care, later became an acute care nurse practitioner, and essentially took care of patients with cardiovascular disease for greater than 30 years across the continuum of care, from both ambulatory setting to the ICU and home again. So really had a strong passion for cardiovascular nursing, took up administrative roles along the way as well, and have served in capacities as director for advanced practice providers, directors for education, was involved with a project led out of Penn School of Nursing with Dr. Linda Aiken on the Graduate Nurse Education Demonstration Project, which is part of the ACA, i.e. Obamacare. So really just love nursing. I can't think of anything else I would have done if I had it to do all over again. It's a really gratifying profession for me. You get the opportunity to interact with people at various phases of their life, and they really entrust you when they're, the happiest of times and also the lowest of times. They really embrace you as their caregiver. And I just really love what I do. And being at HUP, there's no other place I will be to kind of end my nursing career. So I think that's all I'll say for right now, but I'll come back when asked. I'll pass on now to Sharon.
Thank you. Good evening, everyone. I'm so excited to be here. I wish I could tell you that I knew from the time I was 4 or something that I wanted to be a nurse. I can't tell you that because that wasn't true. I was in high school and I was looking at various careers, and I realized that nurses were working continuously and they never had an issue getting a job. Now, you maybe couldn't do everything that you wanted to do or exactly what you wanted to do, but you could work. And that was my goal, was to be independent and be able to put some money in my pocket on a regular. So I was like, why not nursing? My family laughed at me because they said, "You scream at blood. What are you talking about?" But I went. I'm from New York, so I saw there were a few New Yorkers in the house. So I'm from New York City. Hi, I'm from New York City. Grew up in, I call it Harlem, USA, and did all of my education through high school in New York. And then in New York, we have what's called Regents exams. And I won what was called a Regents Scholarship. Now, usually in New York State with a Regents Scholarship, you can go to a 4-year university and it's paid for. None of the schools that were on my top lists were accepting nursing directly into nursing at the time. You had to do 2 years of liberal arts and then reapply. I didn't like those odds. So at the time, Marquette University in the Midwest, I guess they ran a database. I'm not really sure, but I got a letter from them that said, "We'll honor your Regents Scholarship." Okay, I'm going to the Midwest. Now, I have to paint this picture for you because here I am. I grew up in Harlem, USA. And then the last 2 years of high school, my family moved to the Bronx. And then I went to Milwaukee, Wisconsin. So you talk about culture shock and you talk about being thrust into a new reality and having to fend. So, and it was cold. It was really, really cold. But I made it through, and it was a tough journey. It was a tough journey. But I was able, with the education and such that I got at Marquette, I applied for a fellowship program at Columbia Presbyterian back in New York because I knew I was going back home. I applied for that fellowship, and it was the first time they were doing it, and 5 of us were admitted. And I started out in a neonatal intensive care unit. And I've never looked back from being in an ICU. I did the NICU for 2.5 years. And then, like Barbara said, I wanted to be a nurse practitioner. I didn't know what it was. It just sounded good. And I said, this is what I'm going to do. But at that time, the neonatal nurse practitioner programs were just beginning to start up. And the most robust one was down in Houston at Texas Children's. So I packed and I moved to Texas. Again, culture shock. Not really sure what I was getting myself into, but learned a great deal. Had the opportunity to work with some phenomenal nurse practitioners and physicians. And then in the course of that, I got a little, it became difficult for me to work with infants that were 24 weeks, 26 weekers, 27 weekers. That just became really hard for me. So at Texas Children's at the time, right underneath, the NICU was on the 3rd floor and the PICU was on the 2nd floor. And so one morning after caring for a 27-weeker, I went down the back stairs and said, do you have any positions? Because I cannot do this anymore. And I went to the PICU. And so I've been a PICU nurse. I've been a PICU educator. I've been a PICU assistant manager, all of those kinds of things. And then midway in all of that, I decided I wanted to be a nurse practitioner in pediatric critical care. So I went to Penn because at the time, Penn had the only program dedicated to critical care for pediatrics. But it was a clinical nurse specialist program when I applied. By the time I started, it was both a clinical nurse specialist and a nurse practitioner program. So I went and did that and left and said, thank you very much, got what I wanted. And many of the faculty were like, you'll be back. And I said, I don't think so. See ya. It's been real, you know? So I left and I worked in phenomenal places, had a lot of really, really excellent experience, and really found out at that point in time is when I found out that I had found my passion. So I really hadn't worked before that. I didn't recognize it was my passion until I became a nurse practitioner. And I realized that nursing was my passion. Continued to do that. And then somewhere along the way, became interested in research. And so despite me telling all of those faculty at Penn Nursing that I wasn't coming back, I came back. And a couple of them I remember very well standing in the lobby on PhD information day, laughing when they saw me because they said, I told you you'd be back. Finished my PhD at Penn Nursing and immediately went on faculty. However, I am what's called a clinician educator. So I still work as a nurse practitioner at Children's Hospital of Philadelphia in the pediatric intensive care unit doing patient care. So I work with residents, I work with fellows, I work with attendings, I work with bedside nurses, consultants, everything in terms of delivery of care. And along the way with that, my research interest and inquiry is nutrition in critically ill infants and children. And so that's what I do. I look at nutrition in that space. and have had the good fortune and great colleagues that I've been able to move that science forward some, and more importantly, the clinical practice forward. So with that, I'll stop and I will pass it on to, I believe, Diane. Thank you.
Thank you. Hi, my name is Diane Gorman. I'm a nurse practitioner, acute care nurse practitioner at Penn Presbyterian Medical Center. I started my career, actually, this is a second career choice for me. I started out as an exercise physiologist and graduated from Temple University in '89. And I immediately enrolled in the nursing school program at Temple University and graduated in 1992. I joined as a staff nurse in the cardiac care unit at Penn Presbyterian Medical Center in 1992, and I've never left. Sharon had a wonderful story about traveling all over the country. I am a Philly girl. I'm one of 10 children, so we didn't do a whole lot of traveling. We stayed put. Our vacation was when we used to ask my parents, where were we going on vacation? And I lived in Glenside, Pennsylvania, and they said, we're going to downtown Glenside. So I am a Philly girl, born and raised. I went to Penn Presbyterian in 1992 and spent 12 years at the bedside as a of then children, actually, because at 12 years, I transitioned to working nights and weekends so I could.
Diane, it looks like you froze. Can anybody else hear Diane?
By then the director, can you hear me?
You're going in and out, unfortunately. Started out strong and then it's breaking up. It's going in and out.
Maybe turn off that. Sometimes if you turn off the video, that helps.
Can you hear me?
Yeah, it's still breaking up a bit and your picture is really fuzzy.
Okay. And then it breaks. Okay, maybe I'll stop my video. Can you hear me?
Yeah, that's better.
There we go.
Eric, can you hear me now? Okay, maybe it was too much for my video and for my microphone to go at the same time.
Yeah, that's better.
Okay. Okay, very good. So I was approached by my director at the time, who now is our chief nursing officer at Penn Presbyterian. And he said, Diane, I see that you love to teach new nurses. I preached it probably over 30, keep a clinical nurse specialist or clinical educator. So I want you to be the clinical educator, but I have to make a deal with you. He said, I want you have to get back in school and get your master's degree in order to do this position. And I said, sure. I said, and I have a deal for you. I said, you have to let me work whatever hours I want, because I want to be available to all the nurses, not only day shift nurses, but night shift and weekend nurses. So I worked 3/12s from 10 a.m. I dropped my kids off at school and they would drive down to work and I would stay till 10, 11 for the night shift nurses. I am the care nurse practitioner program. It took about It took me about 5 years to get through the program, but it allowed me to continue to take care of my children and also to I still work full time as well. After I graduated from Drexel University, I was one of 2 nurse practitioners. We did not have any critical care nurse practitioners at Penn Presbyterian. I was one of 2 nurse practitioners that were hired in the medical ICU. And the director at the time asked me, he's like, Diane, how do you want the role to be? I said, you know what, I've seen nurse practitioners and what I really want to do is be independent. I want to take care of my own patients. I want to do my own procedures. I want to make my own decisions, of course, in conjunction with the medical ICU team. And he said, you got it. You make the role of what you wanted to make. Mm-hmm. And now at Penn Presbyterian, we have over 100 nurse practitioners at mm-hmm. Penn Presby. And we have 4 ICUs that are staffed by all APPs. So in the last 12 years, we've really come a long way. I am the lead hospitalist in the MICU right now. I lead a team of nurse practitioners, physician's assistants, and I have also 5 physicians on my team as well. So I have a total of 13 people on my team that I lead. I hold provider meetings. I precept both APPs and physicians, and the physicians are not residents; they are hospitalists. They're usually physicians that take a year off after residency and decide, and then take a year off, make some money, and then apply to usually critical care fellowship. So it's been a great partnership because I've learned a lot about not only intensive care, but I've also learned about internal medicine as well. I felt like I was an expert in critical care, being a nurse for 30 years, but I learned the internal medicine part from my physician colleagues. I love the job. Some of my research in the unit has been surrounding serious illness conversation. In the medical ICU, I work with chronically ill patients. And anytime a patient is admitted to the ICU, one of the first things I have my team do is we conduct serious illness conversations about what is it our patients are willing to go for or go through in order to have more time. We actually published a paper in Critical Care Medicine on serious illness conversations. So I'm very proud about that work that we do. And we have a joke in our hospital, transfer to the MICU for a goals of care conversation. So it's been a wonderful journey for me. Nursing has been awesome. It has been wonderful to my family. It's been a very profitable career, but you know what? I wouldn't do anything else. I absolutely love it. I never feel like I am working. They always say, if you enjoy what you do, you never have to work a day in your life. And that is truly how I feel. And I absolutely love the career. All right, I'm going to pass it off. Thank you for listening to me.
Thank you, Diane. Good evening, everyone. I'm Rochelle White again, serving as the nurse manager at Penn Medicine Princeton Medical Center in Plainsboro, New Jersey. As Barb, I did recognize and accept my call, I call it. I think it was a call to the nursing profession at the age of 4. And that, I think, was prompted by serving and assisting with elderly relatives. So my grandparents, and my dad, believe it or not, was 40 years older than my mom. So he was like a grandfather figure, although my dad. And so I had a lot of opportunity as a young child to assist others. And it absolutely became my passion to help and to empower others, to serve others, and to improve their quality of life. After graduating high school, I went on to pursue my Bachelor's of Science in Nursing at Fairleigh Dickinson University, growing up in North Jersey, northern New Jersey. So at Fairleigh Dickinson, I, in my senior year, was actually awarded a scholarship towards my senior year for academic excellence, and pursued in a smaller community hospital to lay my foundation of nursing and do my due diligence contributing to med-surg. I served there as a registered nurse, a clinical staff nurse in med-surg for a year, and then pursued my true passion of maternal child health. And that's where I continued to work, improving the quality and healthcare of moms and their newborns. So I worked there in North Bergen for 3 years, labor and delivery in particular, and then mother baby and newborn nursery, or postpartum as it was called then, newborn nursery and the intermediate nursery. After about 3.5 years, of course, I was young and just had a lot of zeal and wanted to go to the inner city and help the underserved. So I went to Newark, New Jersey, to a tertiary care hospital trauma center there in Newark, and worked in the high-risk labor and delivery. And I had an opportunity to serve the medically indigent, of course, the homeless, and moms that were teen pregnancies, um, drug abusers, and the like. And so often you were the only support person. And that's where I really got my self gratification of helping others and others that were less fortunate. And being the educator at the bedside, that's where my passion really is at the bedside. Although now I'm a nurse leader, to empower others and to improve the quality and evidence-based care. I really like the hands-on clinical, and especially as a young nurse, a novice nurse, and then developing my skill set and advancing my education. At Grand Canyon University, I obtained my master's degree in nursing leadership, um, and it's healthcare and nursing leadership. So I am working now in maternal fetal medicine here for the last 12 years in Princeton. Within that 12 years working as the nurse manager, so being promoted to senior nurse manager for 5 years, collaborating inpatient and outpatient, and really improving the quality of care in the outpatient setting for high risk pregnancies. Um, Working in mother baby and at the bedside, implementing evidence-based practice to improve care and quality of care to moms, and also working in a committee now to mitigate prejudices against moms that are high risk, and particularly in the Black and Brown community. So reducing the morbidity and mortality rates um, for this population of people. And in conjunction with that, as working as the senior nurse manager, mother baby, maternal fetal medicine, also as an interim nurse manager in pediatrics. So I had my plate full, and also pursuing my advanced degree. So here in maternal fetal medicine, we serve a vast variety of patients over the we call childbearing years. Most of our patients are 35 and older, so advanced maternal age with a lot of comorbidities. So we do provide both prenatal care as far as early testing for genetic testing and anomalies. So to discover these anomalies as early as possible so that we can offer care. We have a joint venue with CHOP, Children's Hospital of Philadelphia. And so we can refer these patients for early intervention, and we have best outcomes. Why did I choose nursing again to pursue my passion, to make a difference? But then nursing leadership is here. I started after I left the tertiary care center in Newark. I went on to manage a private practice, and that's where I began my leadership role, a private practice, solo practitioner, OBGYN practice. And I provide services from patient care to ordering the supplies, and really had that cumbersome experience as far as managing an office setting. And then coming here in Princeton, being afforded the opportunity to manage here in maternal fetal medicine and to collaborate with my colleagues here to improve the care of mothers and their newborns. So where do I see myself? I see myself as far as advancing and given to patient care and customer service is another passion. Besides the clinical side, I also participate in a lot of the patient rounding, nurse leader rounding, not just rounding on the patients. It's also important to round on your staff to make sure they have everything that they need. They have all the resources that they need to provide the care, the excellent care at the bedside, to empower them, to encourage them, to make them excited and passionate about what they do. We are a magnet designated hospital, so I do work closely with the team, leadership team, on our magnet journey and redesignation as a magnet institution, um, empowering nurses to participate in our shared governance committees. So it's no longer delegating down from our executive leaders, but everyone working together in shared governance to provide the best care, quality care, and innovating, becoming innovative and doing the research to find the answers to improve our qualities and our outcomes. So I do work and I'm passionate about patient rounding and improving their experience, and not just meeting their expectations, but actually exceeding their expectations and having that wow experience for all of our patients. And just really treating everyone uh, the same, unprejudiced, unbiased culture that we have here in Princeton, offering them the best opportunity and doing the referrals that are necessary. So serving within the walls of our institution, but also branching out into the community. Um, so this is who I am and how I got started as nursing in my nursing journey. And I look forward to coming back again and answering some more questions or expounding more on my experience.
Well, thank you all for sharing your personal journeys to nursing. I find it so interesting to learn more about that. And I think it just shows that, one, there's no one path to nursing. And there are also so many things you can do within nursing. So just again, to emphasize how diverse a career nursing can be and all the different things and pathways and avenues you can go with nursing. Now I'd like to switch, if, excuse me, you could all share a little bit about what it's like working at your hospital. And of course, you're not HR, you can't give the typical HR spiel, but if you can talk a little bit about what opportunities are there for new nurses or nurse practitioners? If many of you are involved with education and precepting, what you look for in new staff members, the attributes that you look for, things that could help when our panelists are applying for the wonderful open positions at your hospital. And also, you touched a little bit about professional development in your personal journey, but any professional development opportunities at your hospitals as well.
So I'll start. Once again, I'm Barbara Todd. And I'm at the hospital at the University of Pennsylvania, as was mentioned, which is also called HUP. And HUP is really one of the oldest teaching hospitals, the first teaching hospital actually in the country, going back to like 1874. HUP is really a world-class organization with really a tripartite mission, really focused in on providing, superior, patient care, research, education, and really, meeting the individual needs of patients in highly specialized care. We're a busy hospital getting ready to expand. We have capacity for greater than 750 patients. We are ranked #1 in the Philadelphia region, and also in terms of the nation, ranked 15th in terms of the US News and World Report. As a hospital, from a nursing perspective and nursing standards, we are magnet designated, as are all of the hospitals that are in our system. So I think when you are in a magnet organization, there's a certain degree of nursing autonomy, power, structural empowerment, that you'll see all those tenets of magnet that really come through at HUP. As I said before, I've worked at HUP for greater than 20 years. I kind of left and then I came back. So I came back to this place. It's a really great environment to work in. I did not work at HUP as a staff nurse, but I did work at HUP as a nurse practitioner and as an advanced practice nurse. So I found it to be, back in the 80s when I was a nurse practitioner there was a lot of mystique around us. So they really didn't quite know who we are, what we could do. Are we part of medicine? Are we part of nursing? But, the evolution of the nurse practitioner role at HUP and specifically at Penn Medicine has been, like a quantum leap over the last 20 years. We started initially with a small group of us, probably less than 10. And right now at HUP, we have like greater than like 300 nurse practitioners. And across the system, we have like over 1,800 nurse practitioners practicing in various type capacities. So, as they become more familiar with the nurse practitioner model of care and the collaboration with our physicians and how that team works together to really optimize care for patients, it's just really a great environment to work in, to really bring evidence to the bedside, to really drive patient care outcomes. When I think about in terms of nurse practitioners, in terms of supporting them when they come into the organization, we have a transition to practice program, which is really supporting that new NP to transition from the RN role into being a nurse practitioner. You may say, why do you need that? But it's really a huge leap from being the clinical nurse to now being the nurse practitioner. And it's not only the clinical skills where there's the transition, there's that socialization and role identity and really kind of taking on this new space, so to speak, to function in the provider capacity. In terms of our clinical nurses, we have lots of clinical nurses. We have an advancement program for them as well. And the clinical nurses can advance. We also have a distinguished nurse clinician academy, which really supports nurses who want to stay at the bedside. Oftentimes I see our nurses come in and they want to go right back to school. But we want to support people and encourage them also to stay at the bedside delivering patient care. And not just want to go back to school the minute they come in, but oftentimes they want to go back to school because it's sometimes become peer pressure within the group that you're working with. Everybody's doing it, so I need to go back to school, and just that pursuit of lifelong education. So, we do have tuition benefits that support you to go back to school. And then working closely with the nurse managers are highly supportive of nurses who want to do that as well in terms of the schedule flexibility that has to be taken into account if you're thinking of going back to school. And, oftentimes, when we're looking to hire people at both the BSN level coming right out of school to hiring the nurse practitioners, I know the thing that I always look for when I was in a space of hiring the nurse practitioners was really, I look for people who really were passionate about the work that needed to be done, that really could talk about delivering evidence-based care, who was really focused in on the patient and the family, and not just, I want to have a position at a Penn Medicine hospital, but they were really there because they were very interested in the population and really improving outcomes of care for that particular, patient group. And, we have that type of culture. So we want to bring people into the culture who also will continue to foster that level of care and really be at the level of care that we want delivered to our patients and families. So, those are kind of the things we look for. I think it's a very, very supportive environment at HUP to practice as a nurse or an advanced practice nurse. And there's all different levels of nursing. And I think you can take your career to as far as your imagination can go in terms of the heights, in terms of your career. I think there's space for everyone. There's space for the entry-level nurse as well as the nurse like Sharon, who's doing PhD and practicing clinical, the clinician educator and being at the bedside and really helping us with our, some of our nurses that have also received doctorates that are also just implementing, best evidence to improve patient care. I'll pass on to Sharon at this point.
Sorry, I was muted there. So, like Barbara, I keep saying that because maybe one day I'm gonna be like her when I grow up. I've known Barbara
Me
for
too.
a few years now. So, I have the good fortune in my career and currently to have worked at some of the best children's hospitals in this country. I worked at Texas Children's, I worked at Stanford, I worked at Milwaukee Children's while I was out there. I worked at Columbia Presbyterian, and now I'm at the Children's Hospital of Philadelphia. And by far, at CHOP, there are opportunities that I did not see at any of those other places. And I say that because you carve your road, okay? I have the good fortune in the ICU. There is one of my colleagues who has been at the bedside as a nurse 37 years. We just celebrated with her 37 years at the bedside with her BSN, never had a desire to become advanced practice or anything else. And I am here to tell you, when she speaks, everybody listens. I don't care if you are the surgeon. I don't care if you are the chair of the department. When Donna speaks, everybody stops and listens to what Donna has to say because they all recognize that nobody knows better than she what is happening hour to hour than that with that patient. And I cherish the relationship that I have with her because I have pulled her into my class. I told you I teach. So I have pulled her into my class to enforce that with nurses. Like, you can be that nurse leader however you choose to be that nurse leader. You don't have to be the advanced practice. You don't, you can be, absolutely, but you don't have to be. So in terms of opportunities and such, so at the Children's Hospital of Philadelphia, we are, I don't know the exact number, but I know that it is more than 650 advanced practice nurses across the institution, right? So that's inpatient, that's outpatient. Across the institution, there are more than 650. I work only on the inpatient side. I work only in the, well, I shouldn't say only in the ICU. I work primarily in the ICU. And then we have what's also called a progressive care unit. And I don't call it step down because those children are equally as sick. Diane and I were talking before we started about the chronically critically ill patient. And that's what we have. We have a 25-bed unit on top of our 60, I believe we're now licensed at 68 beds for the ICU. So we have over 80 beds that we rotate between as nurse practitioners. It's hard for me to describe what that experience is like. And I say that because you can carve out your niche within that as you deliver care. Yes, you are responsible as an advanced practice nurse for the entire patient and for developing the plan of care, but you're also responsible because, and I tease all the time, and I work with the nursing staff all the time, and I tell them my cutoff is I will help you give a bath, I will help you change a diaper, I will help you do all of that. I'm not testing stool anymore, okay? That's my cutoff. I'll do everything else. I'm not testing stool anymore, okay? Because the first part of being a nurse practitioner is being a nurse. And you have to be able, for me, I had to be able to continually take those skills and that knowledge and put it back to the bedside so that not only am I verbally helping and mentoring my bedside colleagues, but I am modeling for them as well how to do that teamwork, how to work interdisciplinary wise, how to collaborate with each other, because they have information and skills that I need as an advanced practice provider, just like I have skills and information that they need at the bedside. And we need the residents. and we need the fellows, and we need the attendings, and we need the respiratory therapists, and we need the children at CHOP and most children's hospital. We have child life specialists, right? So we need them too. And so I see my role as a facilitator to some degree, to make sure that when the needs present themselves, that I can help to call in the right people at the right time. Now, no different than any of you that are working or planning to work in adults, we deal with families as well. Okay. Now, people, we were talking about this earlier about they don't ever want to take care of children because how can you do that? For me, how can you not do that? You know, I just love taking care of kids, and toddlers are my favorite age group, all with their like, no, no, no. And with their, you know, like the world revolves around them at that point in time. And so I see a big part of my job is for them to let me in their world and for them to trust me a little bit because they're sick and I can help them, you know? And so however I have to, whatever I have to do that, that's what I do. And people laugh and they're like, how did you get that kid to drink that medicine or take this or do whatever? Because they weren't doing it for me. And you learn over the years how to do it. In terms of, in terms of opportunities, you can work anywhere as a nurse. Let's start there. And when you work in a large environment like HUP, like Princeton, like Penn, like CHOP, opportunities abound within your organization. There are nurses that I worked with in the ICU over the years, and one is now the director of medication safety. Another is one of the associate directors in patient quality and safety. Another is, you know, working in transport. Another is doing nursing education. So you can be and you can go wherever you really want to go. It's not easy. I'm not going to tell anybody it's easy. Nursing's hard. Nursing's hard work. But taking care of patients and their families, we should want it to be hard work. Because if it were us and our family, we would want somebody to be serious about what they do, know what they do, know how to access their resources, right? And then know how to pull that all together. And I think that's the essence of what we do as nurses. Like we are the ones that really recognize all that's happening. What do I expect from bedside nurses and from early advanced practice nurses? So I think in terms of the new to practice nurse, right? I want you to recognize that you are still learning and you will learn your entire career. And this is kind of interesting for me because I just had this conversation with my students this morning about them constantly learning. And they were like, well, we should know this. No, not necessarily. You are constantly learning. And the day that you are not learning is the day you need to look in the mirror and say, am I doing the right thing anymore? Because you are constantly learning in this profession. And I think all of my colleagues here would agree with that, whether you are doing advanced practice education, whether you're a manager, as a hospitalist leading a team, you are constantly learning because none of us knows everything. So I expect a entry level amount of knowledge. And what I mean by that is I expect you to be able, as an ICU person, to be able to recognize difference. Difference from you came to that bedside and you may or may not know what the true vital signs are, but something is different about that patient. And if it makes you uncomfortable, then you need to call somebody. Call somebody if it's different. And that's really what I expect because then you can build on that, you know? And then at the advanced practice level, depending upon how much experience, education, exposure you've had before you've become an advanced practice nurse, one of the things that I look for is, can you figure out that you know what you don't know, right? So what do I mean by that? Can you get to the bedside and because you've had some nursing experience, you can do that assessment, but you might be listening and there's a murmur that you've never heard before. Can you say, I don't know what this is, but doesn't sound right? Okay. Can you listen? And those breath sounds are like, oh, wait, it's supposed to sound like a wind tunnel, and this sounds like a washing machine. You know, can you recognize the atypical and then be able to say to somebody, I need some help? Because nobody expects you to know everything. On average, it takes from the experienced bedside nurse to the comfortable advanced practice nurse, it's anywhere from 8 to 18 months. And that's after you're done with your orientation, right? Diane's like smiling and laughing because that's what it is. So you can't expect of yourself that, you know, in 4 months, you're going to be that expert because you're setting yourself up, you know? So I think recognize that it's a journey and it's, you know, little sprints along the way. It's a marathon, it's little sprints, and you might attain a lot in the beginning and then you hit a plateau and then you're like, okay, now what? Well, now what is making sure that you are mastering that knowledge and those skills and those things that you have attained to that point. Because then once you master it, what you've learned to that point, you begin to discover the next step of things that you need to work on, building on that experience. But I think you can go into, and I think those things are true whether you do education, whether you do administration, whether you do patient care, whether you do research, whether you do industry, whether you know, just take that knowledge and apply it elsewhere. I think those are skills that are always ever present and ever useful. And I'll stop there and pass it to Diane.
Excellent points. Excellent points. It's funny. I am right now. I did not mention this in my initial presentation that my daughter just graduated from nursing school, and I'm so proud that she actually saw how much I enjoyed nursing, that she actually pursued a career in nursing herself. I am very lucky. She was actually working as a nursing assistant in my unit and the medical intensive care unit. And now she is a nurse in our heart and vascular unit. And every day when we come home from work together, I talk about patients with her. And I want to talk pathophysiology, and I want to talk, tell me about your patient. And she goes, Mom, I'm learning how to prime an IV and work a pump. And she's like, you got to give me some slack. so, and I totally understand that. And she goes, Mom, she described the patient to me last night. She said, I felt like I wasn't advocating for him. He was in so much pain, and I felt like the medicine I was giving him was not enough. And I felt like at the end of the shift, I just didn't advocate for him enough. And we talked about what she can do. And she goes, I'm so afraid that when I come off of orientation, I'm not going to recognize what I don't know. And I said, you will. What Sharon just explained about if you just don't feel good about something and you just say, I just don't think that there's something right here, you get someone who does. And I said, the best thing you can do is after you give nurse to nurse report is get up and go into the patient's room and look at the environment. Is the environment the way you would leave it? Or the nurse, like if you walked into that room, is the environment clean? Are things put away? Is everything safe? Are pumps cleared? Are drips at the right rate? You know, I said, and then you learn, because if you bring in an experienced nurse into the room and she or he is able to look at your environment and said, you know what? My daughter's name is Madeline. Madeline, you did a great job here. The patient is clean. The patient's taken care of. The patient looks happy, and your environment environment is nice and neat, but this is what I would have done. So I said, get your feedback from some of your colleagues, you know, and I'm so enjoying watching her grow up as a nurse now. So, and it brings me back to 30 years ago. I spent 17 years at the bedside. And that's one thing that I love about Penn. And Barb said it in her presentation, is that Penn looks within and they bring you up. My director recognized that I love to teach, and he said, you're going to be the clinical educator, you're going to get back in school, you know. And I did 17 years at the bedside, and I was an expert critical care nurse. I became an advanced practice nurse, and I just hated being a novice again. Hated it. I wanted everything right away, and I knew that wasn't going to happen. So I just, every night I brought home Harrison's internal medicine book home with me, which is about this thick, and I just read a chapter every night. And that's what you have to do. Nursing school is only the beginning of your education. You really have to go home and say, I didn't know what heart failure was. Now I know. I'm reading about heart failure. You take one topic at a time and you just try to digest it. You know, nursing school is just the introduction, but you know, you're opened up to a whole new world, and it is a fascinating world to be a part of. I'm going to hand it over to Rochelle so she can make some comments as well.
Thank you, Diane. So along with my colleagues, I agree with preparing yourself educationally and establishing that experience. I also like to focus on core values. So core values of integrity and character building, so that you can work from your heart and passion. And you produce the best care, and you care for others as you would want to be cared for yourself. So following that golden rule. So here at Princeton, we do foster a culture of excellence, being culturally competent, treating everyone justly and fairly. Also just providing quality care to everyone across the board. So empowering our nurses to ask the right question, creating that environment and that culture that there's no intimidation, there's no wrong answer, no wrong question that you can ask. And again, just being accessible as a leader, that you're visible, you're rounding on your staff so that they see that you're there, you're supportive of them, and that they can come to you without inhibition. Being your authentic self, I think, is very vital, that you're approachable, that you listen, you're an active listener as a leader, and also, you know, creating that space for your staff to be able to come in and having that open door policy with some guidelines. But providing quality care is, you know, providing the quality care for all of our patients, evidence-based care, supporting them at the bedside, but then also empower them and encouraging them, our staff, to move forward, to participate on those groups and research, for research and innovation, to be a part of the growing team. There was something else, I'm sorry. Sorry about that. There was another point that you asked us to speak to, Jamie. I'm sorry, if you can repeat.
Anything specific about your institution,
Oh, yes.
Professional development, any
Sure.
opportunities?
Thank you for that. So yes, as far as professional development, there's opportunity when you come in as a novice nurse to participate in our residency program. It's a nurse residency program, and that actually it's a qualification that all nurses have to participate in. And that's for a year, and it provides that platform for them to be mentored, to obtain the skills and the support, but also the confidence and caring for the patient. Once a week, they do go as a group. And in the beginning, within that first 16 weeks, they have a classroom setting. And so they work and they collaborate together with our nurse educators. And so that, again, affords them camaraderie and team effort, teamwork, and working on different projects together, and then taking what they've learned back to the bedside. So that supports them as a novice nurse within that first year. And then also, thereafter, they're promoted to clinical nurse 2, level 2. And that's a part of our CARES program of identifying and recognizing excellence. Once they begin to collaborate and become an exemplary nurse, and they're engaged and involved in best practice and our shared governance, then there's opportunity to advance to clinical nurse 3 and clinical nurse 4. And of course, they have salary benefits to that. As far as education and staff development, there is a robust tuition reimbursement program, and education and ongoing learning is just fostered. We do offer a mentorship program with our nurse leaders, mentoring other nurse leaders, as well as staff nurses, engaging them in different projects, unit-based projects and organizational projects, as well as the succession program. So like others have said, really supporting and promoting within. And I think that grasped my attention as well. Currently, my director of nursing started here as a staff nurse out of nursing school, and now is one of our directors of patient care over the women's service line. And also our associate chief nursing officer. She started in the ICU as a staff nurse out of nursing school, and was promoted across the continuum of care and different leadership positions as the assistant nurse manager in critical care, then the nurse manager, and now director. She was a director of nursing, and then as the associate chief nursing officer. In my master's program, Karen is her name, she mentored me through my last research project in nursing. So there's a lot of opportunity of engagement and advancement internally, supporting each other. What do I look for in a nurse as I'm interviewing and hiring? As I stated, integrity and character. How do you work as a team player? What are your passions and goals to advance the nursing profession? Are you looking for opportunities to improve? Are you asking those right questions? Are you coming, you're engaged every day, you're empowered? So delegating opportunities for them to improve. And I really believe that if the nurse is engaged and she's excited about learning herself and improving and seeing the outcomes in her patient and the improvement in the care that we provide, that's the best nurse that we can have, one that's engaged and she's energized by learning and by improving the care. That's someone that we look for, someone that's going to be dedicated and committed. And also just really fostering that environment where nurses are becoming life learners. They're looking for opportunities to advance themselves, and just empowering them in that way.
Thank you.
Thank you. Thank you.
Thank you, everyone, for sharing. We are going to get into the question and answer period. So we'll be able to take some questions. I see some questions coming in the chat. So if you want to continue to ask them. Just very quickly, before we get into questions, I want to promote our upcoming admissions webinars. If you've enjoyed hearing about the different pathways to nursing, we have several webinars coming up about our programs. We have one focused specifically on our postmaster's DNP and executive leadership DNP programs. And then we have two general webinars that will focus on all of our programs, the admissions requirements and tips and tricks. And you'll get a link to that tomorrow with a recording of this webinar. So back to our Q&A. Again, please feel free to type in questions in the chat box. I see there's the first question from Jordan, who I believe said they were from East Harlem. They wanted to shout that out. This question is specifically for Rochelle from being a labor and delivery RN in a trauma unit and all of your experience in mother-baby nursing leadership. Did you ever consider becoming a certified nurse midwife? How did your career journey intersect with nurse midwives in underserved populations? And thank you for your time.
Thank you for your question, Jordan. So yes, I did have an interest when I worked in the inner city, actually at University Hospital in Newark, now purchased and operating under Rutgers. And there was a midwifery program that I actually applied to and was accepted. But at the time, I was recently married and began my family within a couple of years. And it just did not pan out for me. As I started rearing my children and working full time in nursing, I just felt it was my children's opportunity. It was their turn, if you will, to focus on their education and being the best mom I could be to help them become successful. And hence, after so many years of nursing, 30 years as Diane, I went back to school for my advanced degree because my passion and everything was on my family. And although I needed to work and was working clinically at the bedside, it just was not the opportunity for me to go back to school. Not too late, however. So still, it's a passion of mine. I think I, afforded my patients the best opportunity as I could, being right at the bedside, hands-on. I was not the nurse that you would find at the nurse's station. I was very much in the room and engaged to support her at the bedside and to bring her to a successful delivery. Did I complete the answer to your question, Jordan? Yes.
There was another part. How did your career journey intersect with certified nurse midwives in underserved populations?
So yes, as I stated, at University Hospital, there was a full staff, a full complement of nurse midwives on the unit, working shifts as we were, and covering our outpatient clinic, and as well as the midwifery program there at University Hospital. And then I did, for a period of time, work in Patterson at St. Joseph's Hospital, which is also inner city, and there was a midwifery program there as well. So collaborating very closely with our midwives and working hand in hand, tandemly at the bedside. And here at Princeton, we do have one private physician group that has a midwifery staff of 5. So again, they are here and they cover the unit as well. So we work, again, hand in hand with them to provide the excellent care that we do here at Princeton as well. Thank you.
Looks like this question is for anyone who can answer. It's from Laura. I'm interested in working in the ER or ICU after graduating. I'm drawn to Penn because of the population I'd be able to serve. Currently, I'm an EMT in Wilmington. Are there any particular certifications that would be beneficial to have prior to applying, such as ACLS, PALS, etc.?
I think I was a BSN graduate and I went right into the ICU as a new grad. Back in 1992, we had a gateway to critical care. As mentioned by Rochelle, we do have a residency program. We do take new nurses into critical care. In particular, the one unit that actually took my daughter as a new graduate was the heart and vascular unit. Just because there's a lot of different equipment that the nurses get exposed to. As far as training, you get ACLS training on the job. if you want to be an ICU nurse. So you do get that as a part of your training. During the court, only because I'm going through this with my daughter, is that she meets with her clinical nurse specialist, her nurse manager, and plus her preceptor frequently during her orientation, and they talk about what things that she needs to improve on. They talk about what organizations she should join. The American Association of Critical Care Nurses is an excellent association to join when you're a new nurse. That's where you get the certification after 2 years of being a critical care nurse as a critical care certified nurse. And sorry, my computer went out there. And so there's a lot of opportunities for new nurses in critical care. So, and Penn gives them as well.
And I would just add there's a year-long residency also for new graduates. So the new to practice nurse, there is a residency program that you go through, which is very structured.
And I'll piggyback off of both of those answers, that at Children's Hospital and at a number of children's hospitals, people come with very little pediatric exposure. And so there are robust programs in terms of exposing you to what the care is that's different caring for children. Because it is different. They are not just little adults, right? They have congenital differences, they have just physiologic differences, they have anatomical differences because they're still growing and developing. So we have all kinds of programs that will help the new to practice nurse in those environments. In terms of, I would agree with Diane, in terms of the ACLS and PALS and ATLS, and the acronyms go on and on and on as to what you will and can attain. Those come with as part of your working in that environment. So I hope that answers your question.
Let's see, we have another midwifery question from Taylor. Do certified nurse midwives practice in most of your facilities? If so, is it triage based, or do they manage their own patients, and can they act as first assist during surgeries?
So being the maternal child health nurse on the panel, and so yes, to both of your points in your question, they do cover not just triage, although that is a part of their responsibility, but the full management of the laboring patient. And they do serve as the first assist for C-sections. Back to Jordan, I guess I would add that we also have midwifery students from Penn that come to Princeton, and they do rotate throughout our program here, even in maternal fetal medicine, for training and shadowing the provider here with the non-stress testing or antenatal testing, and exams and limited ultrasounds for nurses. So that's something, a skill set that they can acquire and cultivate here in maternal fetal medicine in conjunction with their experience and training on the labor and delivery unit.
So I can speak to certified midwives as well, because Children's Hospital Philadelphia has one of the only in the country special delivery units within the Children's Hospital. So yes, we do have nurse midwives that help to, I don't want to say man, but they staff that unit. There is an obstetrician. I'm not sure the exact numbers because in all honesty, I stay away from there. There have been occasions that we have to go down because the mother gets into trouble. And so, you know, from the ICU, we go down. But there are nurse midwives that staff that unit. There's an obstetrician that works with them collaboratively. And the reason that they do that, these are high-risk pregnancies and high-risk deliveries. And so we know that there's something that is not correct with the baby may need surgery right away. And those of you that are interested in that, and Rochelle will know that the outcomes for those families and those infants are much better if you can minimize their transport time. So that's why we have that unit. I believe it's 12 beds, but please don't quote me on that because I'm not exactly sure exactly how many beds there are, but we have one of the few units in the country with that.
We have a question from Miriam, who is a West Philly native and Howard University graduate. How did you decide between acute care and primary care? Also, how do you make space for research in your career? And this can be for anyone.
I can start off talking about the acute care and primary care piece of it. You know, when I went back to be a nurse practitioner, primary care, for the most part, was the only thing available when I finished my MP program in 1984. So, but I think one of the questions you should ask yourself is, what do I really want to do in terms of my advanced practice career? You know, oftentimes I would hear a lot of young nurses talk about, I want to be more marketable. So I'm going to go back and become a primary care nurse practitioner, you know, because I can be a family nurse practitioner and see babies, children, adults. And that may not be the correct answer, depending on what you want to do. And I think, you know, as acute care programs have evolved, now we have the availability of not only primary care nurse practitioners, but also acute care programs. And we also have this thing called the APRN consensus model, which really dictates where you really can practice and ensuring that your certification, your licensure, your education, and the populations that you serve really line up. So initially I chose primary care because that was the availability, but my love and passion was always in acute care and cardiovascular care. So I was able to marry those two and make sure that I was appropriately certified to take care of that population of patients. And I'll let Sharon speak more to this in terms of research, but I think the research questions actually come from your practice. So when you are taking care of patients, you often ponder about, you know, what are the right things to do? Are we doing the right things to affect whatever outcome we're trying to achieve? And so I think that you make room for research kind of organically. It kind of, you know, comes into your everyday practice. And I think that's the best of all worlds when you're practicing, when you're able to blend it all together and you don't have to do it by yourself. You're in a team of providers that are really looking to improve patient care. So I think it can really come together nicely, you know, in your practice. And shout out to Howard University.
Yeah, I'll say that my research absolutely sprouted from my patient care. Absolutely. Particularly in nutrition in critically ill infants and children in that space, right? Because when I started out as a nurse, we'd put them on IV fluid for 3 days, 4 days, 5 days, 6 days, 7 days. And that just didn't make sense to me. It just didn't make sense, you know? And so as I begin to delve into that, it's true, it didn't make sense. And so, why weren't we feeding these babies? And why weren't we doing these things? But you can imagine in 93, as a new nurse practitioner, they didn't want to hear that from me. They were like, this is what we do, put them on D10, maintenance fluids, they're good for 7 days. And I'm like, but put them on D10, maintenance fluids, they're good until they're you know, getting better. And I really just became the nemesis. You know, I'm not recommending that. Let me be clear. But what it did for me at that point in time was they knew every unit that I worked in, every attending that I worked with, they knew that if I was on rounds, I was going to ask, what are we doing about nutrition? And so then it became like, Sharon's going to be in this team today. You better say something about nutrition, right? Because it wasn't making sense to me. And so I gradually, I worked initially and continue to work with some fabulous registered dietitians that I learned a lot from. And we always tease because they're like, you have the questions, we just help you along the way, right? Because I'm the one that, because of my training, I'll put the studies together and I'll put the question together, but I certainly learn along the way. And it's something that I'm really interested in that I can bring back to the bedside. That was a big part of the research for me. I didn't want to be doing research that it was going to take 10 years before it was be able to be instituted and make a difference in patient care. I wanted to do something that tomorrow we could start doing. And so that's one of the things that kept me at the bedside and doing the research that I do.
So I think we'll take one more question, just looking at the clock. And I'm just skipping around. I think this is a good question to end on from Chang Mei. I'm 30 years old, planning to go back to school, to see she's waving, to be a nurse. Been a paralegal for 5 years, and I felt so helpless during this pandemic. I think a lot of us can relate. I'm a little worried that I'm older than other students and kind of behind in terms of career path. Do you think it is still a good idea to pursue my dream?
Age is a number that scares other people. And that's what I think about it. It scares other people,
Mhm.
right?
And people also, I mean, a lot of people pursue nursing as a second degree. I did as well. I was, 25 when I graduated from nursing school, but I encourage you to go back to school and pursue your dream, because it is a fabulous dream and it is an awesome career. So do not be ashamed of your age about going back to school. I see it all the time at work. I love it. Even I have, nursing assistants who are older that actually love to see what the nurses do at the bedside. And because they were nursing assistants and they saw what nurses did, they went back to school to become nurses. So I encourage you, go for it.
I encourage you as well. I went back to school to get my doctorate 26 years after my master's degree. So, you can go back to school. I didn't know what I was doing back taking statistics. 26 years after my master's, I was like, what did I really do here? But, it's just really, great. Lifelong learning. That's what we do. And so I would really encourage.
Like everybody else, it wasn't quite that long, but I did big gaps in between my degrees. I did big gaps all the time, and don't worry about your cohort, and you will blend, because there'll be things that you bring to that cohort and there'll be things that they bring to that cohort, whatever it is, right? And so you'll blend and you'll be able to do things together. Don't worry about it. As I said, age is a number that scares other people.
Wow, this has been great. I can't thank you all enough. Barb, Sharon, Michelle, Diane, thank you so much for joining us this evening. This has been a really captivating panel, I have to say. Jamie and I, our job is admissions. And what we are hoping to accomplish by having these panels is really to engage with prospective students. For us, it's just not about recruiting you into a program. We really want you to understand what Penn Nursing is all about, the type of career you can pursue. And as you can tell from our panel, it's a very rich, lifelong career. So when you come to Penn Nursing, it is an investment. It's an investment in your career. But the reason why we had this panel tonight is for you to see the full breadth and depth of what an education in nursing can provide to you and your family. And so again, I thank you, the panelists. I thank all of you for joining us this evening. I hope you will continue to engage with us, during this webinar series, and many more to come. Hopefully, when this is all over, we can get back on the road and meet you in person and invite you into our school. We do open houses twice a year, one in the fall and one in the spring. We really enjoy you coming to the school and again, engaging with our faculty. Our faculty are very much involved in the recruitment, in the admissions process. So we continue, we hope this is the beginning. I know many of you are, this is probably your second, third, or fourth webinar. So thank you for coming back each time. And we're hoping we're providing with more and more information so that we'll see you in person as a student and hopefully as an employee at one of these fantastic institutions. And so again, I can't thank you all enough. I miss seeing you all in person, Rochelle and Diane. It's nice meeting you. Sharon, I miss our hallway
I
conversation.
know.
Barb, it's a pleasure seeing you. I think it's been over a year. Thank you again, Jamie, for facilitating. And everyone, thank you again. If we didn't get to your question tonight, please join one of our later webinar series and we'll try to circle back and get back to you. You can also reach out to us via email. Jamie, I'm not sure if you have our admissions email address, but you can contact us at any time. We'll get the questions back to you, admissions@nursing.upenn.edu. So we know it's late, we went over, but thank you all again. This has been a fantastic session. It's being recorded. We'll send it out to you as well. Again, panelists, thank you so much for joining.
Thank you very much for having us.
Thank you, everyone.
Thank you. It's nice
Thank
meeting
you.
you all.
Thank
Bye,
you.
everyone.
Thank you.
Take care. Bye-bye.
Bye-bye. Take care.
Bye-bye.